Hello, welcome to the Child with Altered Mental Health, Neurological, Developmental, or Learning Disorders. So the concepts we're going to start with is development. And we have talked about this, but development is talking about progression of function and skill. We're talking about how the behaviors grow, right? As development progresses, each person becomes unique and different. For example, all babies do pretty much the same thing and look very similar. As they grow and develop, they turn into very unique individuals, okay? We are going to talk about ADHD, autism, cerebral palsy, and Down syndrome. Those are exemplars for this discussion. So let's start with our ADHD. ADHD is now been added to the Diagnostic and Statistical Manual of Mental Health Disorders in the 5th edition. So this should be fresh with you. You just had mental health. There are two major subtypes. There is an inattentiveness and an hyperactivity. The inattentiveness is what they would refer to as ADD, attention deficit disorder. And really anymore, they don't necessarily differentiate between the two of these. They pretty much consider everything within the realm of attention deficit hyperactivity disorder. The reason being, you don't necessarily have to be physically hyperactive, but it has to do with how your mind is working as well. Okay. When you combine the two, we have the combination of inattentiveness and hyperactivity. We have attention deficit hyperactivity disorder, or ADHD. Okay. It is defined as a persistent pattern of inattention that interferes with functioning or development, and it is categorized by inattention and or hyperactivity or impulsivity, okay? All right, so this first column, we have the inattentive or the ADD symptoms, all right? You can read the list here. A child must fit within 6 of these symptoms, and these symptoms have to be present for at least 6 months. Okay, we are going to watch some fun videos in this lecture, but as far as the symptoms for the inattentiveness, 6 or more for 6 or more months. The reason why they want the symptoms to be 6 or more months is because there are other things that mimic attention deficit disorder. For example, divorce or a family member dying. Those types of things, you're going to have a person who has these symptoms, but they generally don't last over 6 months. So we're ruling those other types of things out. Okay. Children with inattentive symptoms tend to struggle in school and get poor grades because of lack of paying attention and being able to follow along. So they're very easily distracted. So you might get reports, if you are a parent with a child with this type of disorder, you might get reports of their heads in the cloud, they're always daydreaming, things like that. When we're talking about the hyperactivity, impulsivity symptoms, again, they must fit 6 or more of these symptoms for at least 6 months. All right. These children tend to get in trouble in school for talking too much and not waiting their own turn. Okay. So they tend to get in trouble in school, whereas the other group tends to get poor grades, and put those together and you have someone who's going to get poor grades and who gets in trouble. Pathophysiology, you can see there, there is a deficiency with the dopamine and norepinephrine and a lower activity level in the right frontal lobe. Causes are thought to be from genetics, prematurity, brain injury, maternal smoking during pregnancy, use of alcohol, you can see there, increased stress and exposure to lead and other toxins. So we don't actually know what causes ADD or ADHD, but these are what we think are the causes, can be contributing factors. As far as diagnosis, children who have ADHD often have other symptoms that are associated with it, and you can see here interpersonal problems, behavioral problems, low self-esteem, anxiety, depression. Evaluation needs to occur. It will consist of parent interview, child interview, observations, psychoeducational testing, and teacher and school reports. So what they'll do in this area is they will send a Vanderbilt survey to the teacher and to the parent, and they will both fill out what in their experience the child's behavior is in their environment. We'll tell you, children's environment are extremely different between home and school. I will give you an example. My youngest child is 7 now. He is a little crazy at home, a little energetic and over the top. But every day when he was in school, he would come home, and they have a behavior chart in first grade, and he'd have to color in the behavior he was, the colors associated to how his behavior was throughout the school day. He always came home with pink or rainbow, which were the top of the chart. I'm like, how is he behaving so great in school, and then he's crazy at home? So they will often use their manners and use all their skills while they're at school, and then they have nothing left for home. It's spent. That's it. It's gone. So they do behave differently. So the doctor will take all those things into consideration. But there is controversy over ADD and the treatment. A lot of people think it's overdiagnosed, excuse me. A lot of people say it's from lack of discipline, or some people think it's underdiagnosed. And so there's a lot of controversy about this. What you will most often see is parents who might be getting an ADHD diagnosis, and their first reaction, gut reaction, I don't want my children on medication. Like, I think that parents just throw medication at children when they're behavioral issues, which is not the point. But we're going to talk about that in a few minutes, okay? As far as diagnosing ADHD, these things that are listed here are often mistaken for ADHD, all right? Medical problems. So eyesight issue and hearing issue. Imagine if you're a child who's in a classroom and you can't see well. How long do you think you'll try to follow along before you just give up? How long do you think you'll try to follow along if you're hearing impaired and you can't grasp all the concepts because you can't hear everything well? It doesn't take long. Dyslexia. As far as learning disabilities, dyslexia is often confused and misdiagnosed with ADHD, okay? So we need to work, and you can read the rest there. There's no specific lab or diagnostic studies, but we need to work with parents so that we don't just jump to an ADHD diagnosis, but that we we come to a correct diagnosis based on that child, okay? All right, now, right here, oh, we went further. Interdisciplinary interventions. It's bright red. Combination is preferred. So what we're saying is there is not just one way to treat a child with ADHD. If you only use one way, you're not going to be as successful. It takes a plethora of different treatments to help support each other and to make the child successful. Imagine somebody who's quitting smoking, all right, and you just say, okay, quit cold turkey. You're just going to stop smoking. Well, so most likely they're not going to be successful. And then you say, okay, just go to this support group. Okay, so they have a better chance of being successful. But let's say, okay, we're going to put you on Wellbutrin. You're going to go see support group. You're going to start seeing a doctor for regular visits. You are going to do all these interventions together to help support and make the person more successful. That is what we want to do. All the research shows with a child with ADHD, one therapy, even if it's just one thing, is not as successful as multiple therapies, okay? So, behavioral therapy and modification. All right, so we're talking about teaching a child to be organized and to be systematic, do the same thing at the same time every day. Help give them expected goals so that they may be successful. For example, you're a nursing student and you have two options. You have an educator who is wildly entertaining and engrossing, and it's great, but very disorganized. It's very hard to find the information. You're not really sure what you need to do to be successful in that class. Then you have a teacher, and I'm not saying they're boring. I'm just saying that they're completely organized and everything is written and spelled out for you in a very systematic and easy learning in a way that is more readily accepted as a learning style. Which would you as a nursing student be more effective with? It is the exact same way with a child with ADHD. When we do the same thing all the time and we have we're organized and things like that, we're giving them more tools to be more successful. All right, so we're using planners. IEPs are extremely helpful in schools, and these are individual educational plans. And more often than not, the parent has to advocate for their child, but they get more testing time. So if they have a propensity for their thoughts to be, or to be distracted, they're going to need a little bit more time, right? Also, a quiet learning environment. So when they take their exams and other things, they're in a quiet area. Again, less distraction allows them to be more successful. Maintaining routines, simple instructions. So as children get older, you can give them more complex instructions. For example, when you tell a 4-year-old, go upstairs and brush your teeth, okay? You can't tell a 4-year-old, go upstairs, go to the bathroom, floss, brush, and get in your pajamas. But you can certainly tell a 9 or 10-year-old that. With a child with ADHD, those instructions get lost in those. So you cannot give them multiple complex instructions because they cannot be successful that way. Give them attention when they're communicating. Look at them, have them look at you, that kind of thing, and model calm behavior. All those things are extremely helpful. All right, so we're going to talk about medications. I want you to understand that the research shows that as far as frustration, school performance, and being able to learn coping mechanisms, children who are on the appropriate medication do better, period. Okay? But at the same time, each family needs to make the decision that is right for them. It is our job as nurses to explain everything and then to help support the family's choice. All right. So as far as these medications, we're going to use psychostimulants, and they're going to have a calming effect, believe it or not. So it's just how they work in the brain. All right. So the methylphenidate, that's a central nervous stimulant. It produces a stimulation in their central nervous system, but it increases the attention span in a child with ADHD. As far as the dextromethylphenidate, same type of thing. All right. You can see there the amphetamines. So right now, the medication of choice is the Concerta. It is a 12-hour medication. It can be stacked as needed, so but generally it is not. It is just a one-time dose, so they take it in the morning, it starts working, it wears off by night. The Vyvanse is a nice one too. It's another daily one. It has less side effects. You still see the Adderall, the Ritalin, and the Adderall. Those ones aren't really given as much anymore, but I will tell you, you'll see the Ritalin and the Adderall with extreme cases where you have to keep dosing them at higher levels. So you want the dosage to be last a shorter amount of time, and then you'll redose them. So these are the kids that in the schools go to school on the medication, go to the nurse's office at lunch and get another dose of medications. Okay. Then you have your non-stimulants like Strattera. All right. And that's a selective norepinephrine reuptake inhibitor that is popular as far as non-stimulants go. The guaifenesin, that is centrally acting adrenergic. Its mechanism isn't exactly known for ADHD, but it has been known to work. All right, so we're talking about the stimulant medication. Side effects: insomnia, loss of appetite. So you already have a child who's very active, so usually slender, and now they have a loss of appetite in the afternoon. Now, generally in the morning, it's not affected, and then they take their dose of medication. Their appetite at lunch is severely compromised, but we encourage them to have proteins. So things like cheese and yogurt and peanut butter and things like that, okay, that will stick with them. And then for dinner, they act like they've never eaten at all and they're starving. All right. Over-focusing, over-concentration can be a side effect. Hypertension and tachycardia. Those can be dose-related. All right. Also, understand they can cause children to be emotional and have anger outbursts as well. Unusual stomach aches and headaches, and unacceptable would be extreme anxiety, tics like blinking eyes, clearing of the throat, nose twitching, or short squawks. No, that would be indication that the dose needs to change or the medication needs to be changed. Non-stimulant medications, you can see the side effects there. So one of the big advantages of the stimulant medication, again, it lasts for about 12 hours. So it's 1 day. So you can go off on the weekends, you can go off for the summer, that type of thing. But for the non-stimulant, you cannot, because it takes 2 to 3 weeks to work. All right, so you cannot take a break. You cannot take a holiday. They are more expensive, but they can also be sprinkled on food, which is helpful. Dose related is moodiness with this one as well. So what happens is your child starts crying for no reason, and you call the doctor, and either they lower the dose, which the medication might not be effective. More often than not, they're going to change the medication, okay? As far as the insomnia with the stimulant medications, most of these children who have insomnia benefit from melatonin at night. But imagine you're a parent doesn't want your child on medication in the first place, and not only do you have a stimulant medication to help, but then you're talking about having to have another medication on top of that to counteract the insomnia of that medication. It can be very overwhelming, okay? All right, misconceptions. And here they are. Ritalin does not make you high if you have ADHD. Does not cause brain damage or mental illness. I will tell you that if you give a child with ADHD who has not done anything with cognitive behavioral therapy, or who has not had medication to benefit them, you give them an IQ test, they are going to score very low. It is not accurate. An IQ test cannot be accurate if the person can't pay attention to the questions. All right? Just because they have ADD or ADHD does not mean they are not intelligent. All right? It has nothing to do with that. Stimulants will not lead to drug abuse or misuse. Sugar does not cause hyperactivity, not when we're talking about ADHD. Caffeine does not cause ADHD. It is a real disorder. It does not only occur in children. We do know that ADHD, some people can grow out of it, but not everyone. We can't tell the parent to expect their child to grow out of it, because that's simply not what could happen. I will tell you, the idea behind all these things and treating it with medication is that you are providing the tools necessary for the child to cope later in life. So the idea is you teach them these things as they are learning, growing, and developing, and then later they don't need these things because they have formed good organizational habits and things like that, okay? Again, we need to make sure that we are explaining the diagnosis to the parent and the child, supporting their decision, providing the education, and we need to talk to them about working with their environment to help their child be the most successful. So I gave you an example about what is like, as a nursing student, but imagine a child, there's 2 teachers coming up next year. One teacher is wildly artistic and wonderful and creative, and the other one is very organized and keeps a very organized class. Well, obviously the child with ADHD is going to be more successful in an organized environment, okay? Sometimes, depending on the severity, children with ADHD do need to be in special classes. Just like with everything else in pediatrics, there is a wide variety of mild to severe cases, okay? So they may need to be in a special classroom. We're going to conclude the first part of this video. When we start the second video, we're going to start with autism, okay?